It can be frustrating, can't it? You're doing your best. Maybe you're taking care of yourself, trying to stay active, but some things just aren't working the way they used to. One of those things that many men worry about, but maybe don't talk about much, is difficulty getting or keeping an erection. It feels like a loss of something important, a part of your vitality and your connection with a partner. You might think it's just a natural part of getting older, or maybe something else entirely, something you haven't quite figured out yet. It's a painful reality for many men, feeling that spark dimming, and often there's a sense of confusion and even embarrassment about it. You might wonder if it's something you're doing wrong, or if there's a deeper health issue you're not aware of. While age and underlying health conditions certainly play a role, there's a secret many men don't realize. Sometimes, the very things you're doing to stay healthy, specifically the medications you might be taking for other conditions, could actually be contributing to the problem. It sounds counterintuitive, doesn't it? That something prescribed by your doctor to help you could have this unintended consequence. But it's true. Certain common medications, the kind many people over 60 take regularly, can interfere with the complex process that leads to an erection. It's not always listed as a major side effect. Or perhaps you saw it, but didn't connect the dots until you started experiencing difficulties. In this video, we're going to pull back the curtain a little and look at 5 common types of medications that could potentially be impacting your erectile function without you even knowing it. It's about being informed, so you can have the right conversations with your doctor. This isn't about telling you to stop taking anything. Absolutely not. That would be dangerous. It's about giving you the knowledge to explore possibilities and work with your healthcare provider to find solutions that work for your whole health picture. Stay with me, because understanding this connection is the first step towards potentially finding some answers and maybe even improving things. And stick around to the end, because what we discuss and the implications for your health might just surprise you. Let's start with the first category, one that affects a great many people as they get older. Certain medications prescribed for high blood pressure and other heart conditions. High blood pressure is incredibly common, and managing it is absolutely crucial for preventing serious issues like strokes and heart attacks. Doctors prescribe these medications because they save lives and improve health in significant ways. But some types, while excellent for your cardiovascular system, can unfortunately have an effect on your ability to get and maintain an erection. The ones we're talking about here are often called beta blockers. You might recognize names like atenolol, metoprolol, or propranolol. How do they work? Well, generally speaking, they work by blocking the effects of adrenaline, slowing your heart rate, and reducing the force with which your heart pumps blood. This lowers your blood pressure and reduces the strain on your heart. For many conditions, they are a cornerstone of treatment. Now, when it comes to erections, it's a process that relies heavily on healthy blood flow and nerve signals. An erection happens when blood vessels in the penis relax and widen, allowing blood to rush in and fill the spongy tissues. Beta blockers, by affecting your circulation and potentially nerve signals, can sometimes interfere with this process. They might reduce blood flow overall, or they might affect the nerve responses needed for those blood vessels to relax properly. It's a bit like trying to inflate a balloon when the air supply is reduced. You just don't get the same result. It's important to understand that not everyone taking a beta blocker will experience erectile difficulties. Many people take them without any issues in that department. But for some men, this can be a noticeable side effect. It might start subtly. Maybe erections aren't as firm as they used to be, or they're harder to achieve consistently. Because high blood pressure itself can also damage blood vessels and contribute to erectile dysfunction, it can be tricky to figure out if the problem is the condition or the medication treating it. This is why the conversation with your doctor is so important. They can help untangle these possibilities If you are taking a beta blocker and you've noticed changes in your erectile function, the absolute worst thing you can do is just stop taking the medication on your own. Beta blockers are often prescribed for serious conditions like managing angina, recovering from a heart attack, or controlling certain heart rhythms. Suddenly stopping them can be very dangerous, potentially leading to a spike in blood pressure, chest pain, or even a heart attack. Your doctor needs to be involved every step of the way. So, what can you do? The first step is to simply mention it to your doctor during your next appointment. It might feel awkward to bring up, but remember, doctors discuss all sorts of health issues with their patients, and this is a common concern. Be open and honest about what you're experiencing. Your doctor can review your medication list. Perhaps a different type of blood pressure medication might be more suitable for you, one that works in a different way and is less likely to cause erectile side effects. There are many different classes of blood pressure drugs available: ACE inhibitors, ARBs, calcium channel blockers, and others, and they each have their own side effect profiles. Switching to a different medication within the same class or to an entirely different class might resolve the issue while still effectively managing your blood pressure. Your doctor is the expert here. They know your full health history and can assess which alternative might be safest and most effective for you. Sometimes, even adjusting the dose of your current beta blocker could make a difference. Lifestyle factors also play a huge role in both blood pressure and erectile function. Things like losing weight, if you're overweight, exercising regularly, eating a healthy diet, quitting smoking, and limiting alcohol intake can all help improve blood pressure control and can also improve erectile function. Sometimes, making these changes can allow for a reduction in medication dose, or in some cases, even switching to a less potent medication, which might then alleviate the erectile issues. It's a holistic approach, managing the underlying condition effectively, while also considering the potential side effects of the treatment. Don't underestimate the power of healthy habits. They support your overall health and can often work synergistically with your medications. Now let's move on to another very common class of medications, one that impacts many people's mental well-being: certain antidepressants. Depression and anxiety are real and significant health issues that can affect anyone, regardless of age. Antidepressants are invaluable tools for helping people manage these conditions, improving mood, reducing anxiety, and allowing individuals to live fuller, more engaged lives. The type of antidepressants most commonly associated with sexual side effects, including erectile difficulties, are called selective serotonin reuptake inhibitors, or SSRIs. You might recognize names like Prozac, Zoloft, Paxil, Celexa, or Lexapro. SSRIs work by increasing the levels of a chemical messenger in the brain called serotonin. Serotonin plays a key role in regulating mood, sleep, appetite, and other functions. By making more serotonin available, SSRIs can help improve symptoms of depression and anxiety. However, serotonin also plays a role in sexual function, affecting desire, arousal, and the physical ability to achieve and maintain an erection. SSRIs can sometimes disrupt this delicate balance, leading to a decrease in libido, difficulty achieving orgasm, and yes, erectile dysfunction. This can be a particularly frustrating situation. You're taking a medication that's helping you feel better mentally, lifting the cloud of depression or easing overwhelming anxiety, but it's creating a problem in another important area of your life. It can feel like a difficult trade-off. Just like with blood pressure medication, it's crucial not to stop taking your antidepressant on your own. Suddenly stopping an SSRI can lead to withdrawal symptoms, which can be unpleasant and even debilitating for some people. More importantly, it can cause your depression or anxiety symptoms to return, potentially worse than before. Mental health is just as vital as physical health, and managing it properly is paramount. If you're taking an SSRI and experiencing erectile difficulties, the first step again is to talk to your doctor or the mental health professional who prescribed the medication. They are aware that this can be a side effect, and they have strategies to help. One option they might consider is adjusting the dosage. Sometimes, a slightly lower dose might still be effective for your mood, but have less impact on your sexual function. Another common approach is switching to a different antidepressant. There are other types of antidepressants besides SSRIs, such as SNRIs, tricyclics, or atypical antidepressants, which might have a different side effect profile regarding sexual function. Some people find that they tolerate one type better than another in terms of sexual side effects, while still getting the mood benefits. Your doctor can help you explore these options and find a medication that works well for both your mental health and has fewer unwanted sexual side effects. Sometimes, a doctor might suggest adding a second medication specifically to counteract the sexual side effects of the antidepressant. Medications commonly used for erectile dysfunction, like sildenafil, tadalafil, or vardenafil, can sometimes be taken while you're also on an SSRI, and they can help improve erectile function. This isn't always suitable for everyone, especially if you have heart conditions or take certain other medications, which is why it absolutely requires medical guidance. But for some men, this combination approach can be a good solution, allowing them to continue benefiting from the antidepressant while also addressing the erectile issues. It's also worth considering the underlying depression or anxiety itself. These conditions can also negatively impact sexual desire and function. In some cases, as the antidepressant helps improve your mood and reduce anxiety, your sexual function might actually improve over time, even if the medication itself has the potential for side effects. It's a complex interplay between mind and body. Open communication with your doctor or therapist about all your symptoms, including sexual ones, is the best way to navigate these challenges and find the most effective treatment plan for your overall well-being. Remember, you deserve to feel good both mentally and physically, and it's okay to seek solutions for all aspects of your health. Now that we've discussed the potential impact of certain blood pressure medications, specifically beta blockers, and certain antidepressants like SSRIs on erectile function, let's move on to another very common category of medications, especially relevant for men over 60. Medications for prostate issues. As men age, the prostate gland often enlarges, a condition known as benign prostatic hyperplasia, or BPH. This can cause bothersome urinary symptoms like frequent urination, difficulty starting or stopping, a weak stream, and feeling like you can't completely empty your bladder. Medications are often prescribed to help manage these symptoms. There are a couple of main types of medications used for BPH that can sometimes affect erectile function. One group is called alpha blockers. These medications, like tamsulosin, alphazocin, or silodosin, work by relaxing the muscles in the prostate and the neck of the bladder. This relaxation helps improve urine flow and reduce symptoms. While they are very effective for urinary symptoms, in some men, alpha blockers can interfere with ejaculation, sometimes causing a condition called retrograde ejaculation, where semen goes backward into the bladder instead of out of the penis. They can also, in some instances, have a subtle impact on the nerve signals involved in getting an erection, potentially leading to difficulties. Again, this doesn't happen to everyone, and for many men, the improvement in urinary symptoms is well worth it, but it's a potential side effect to be aware of. Another important class of prostate medications are the 5-alpha reductase inhibitors, like finasteride or dutasteride. These medications work differently. They target the hormones that contribute to prostate growth, specifically by reducing the conversion of testosterone to dihydrotestosterone, DHT. which is a more potent male hormone involved in prostate enlargement, and also hair loss, which is why finasteride is also used in lower doses for male pattern baldness. By lowering DHT levels, these medications can actually shrink the prostate over time, leading to a more sustained improvement in urinary symptoms. However, because they affect hormone levels, they can also potentially impact sexual function. Some men taking finasteride or dutasteride report decreased libido, erectile dysfunction, or ejaculation problems. This is directly related to the way these medications alter hormone levels in the body. For men dealing with BPH, these medications are often necessary to manage symptoms and prevent potential complications like bladder damage or kidney problems. Stopping them without consulting a doctor is not advisable. If you are taking a medication for your prostate, whether it's an alpha blocker or a 5-alpha reductase inhibitor, and you're experiencing issues with erections or other aspects of sexual function, it is absolutely worth discussing this with your doctor or urologist. Just like with the other medications, there are often alternatives or adjustments that can be made. For BPH, sometimes combining different types of medications works best for symptoms. Your doctor might be able to switch you to a different alpha blocker that you tolerate better in terms of sexual side effects. Or, if you're on a 5-alpha reductase inhibitor and experiencing issues, your doctor might discuss the possibility of trying a different class of medication, or perhaps exploring non-medication options for BPH management, depending on the severity of your symptoms. In some cases, surgical options for BPH are available and might be a better long-term solution for both urinary and potentially sexual function issues, though surgery always comes with its own set of considerations and potential side effects that need to be discussed thoroughly with your urologist. Openly communicating with your doctor about all your symptoms, including any sexual difficulties, is key. They can help you weigh the benefits of your prostate medication against the side effects you're experiencing and explore treatment plans that best address all your health needs. Remember, managing BPH is important, but so is maintaining a good quality of life, and that often includes sexual health. Moving on, let's look at another category that might seem surprising: certain antihistamines. You might take antihistamines for allergies, a runny nose, itchy eyes, or sometimes even for sleep, as some older ones can cause drowsiness. Antihistamines work by blocking the action of histamine, a chemical released by the body during an allergic reaction. While blocking histamine helps with allergy symptoms, some older first-generation antihistamines, like diphenhydramine, found in some over-the-counter sleep aids and allergy medications, or chlorphenamine, also have what are called anticholinergic effects. This means they can block the action of another important chemical messenger in the body called acetylcholine. Acetylcholine is crucial for transmitting nerve signals in various parts of the body, including the nerves that control erectile function. It plays a role in initiating the process that allows blood vessels in the penis to relax and fill with blood. By blocking acetylcholine, these older antihistamines can interfere with these nerve signals, potentially making it harder to achieve or maintain an erection. They can also sometimes lead to dry mouth, blurred vision, constipation, and difficulty urinating, which are other common anticholinergic side effects. Newer, second-generation antihistamines, like loratadine, cetirizine, or fexofenadine, generally have far fewer anticholinergic effects and are much less likely to cause erectile dysfunction. They are more targeted in how they work, primarily affecting the histamine receptors responsible for allergy symptoms, without significantly impacting acetylcholine in the rest of the body. If you're taking an older antihistamine regularly and experiencing erectile difficulties, this is definitely something to consider. Are you taking it for chronic allergies? Is it something you use occasionally for sleep? The solution here might be relatively simple. Talk to your doctor or even a pharmacist about switching to a newer generation antihistamine. These newer options are typically just as effective for allergy relief and carry a much lower risk of anticholinergic side effects, including those related to sexual function. If you're using an older antihistamine for sleep occasionally, discussing alternative strategies for sleep with your doctor might be beneficial. There are many potential causes for sleep difficulties, and addressing the root cause or exploring non-antihistamine sleep aids could be a better approach for both your sleep and your sexual health. Again, the key is awareness and communication. Many people don't realize that common over-the-counter medications can have these sorts of effects. If you're regularly taking something that contains an older antihistamine and you've noticed changes in your erectile function, bring it up. It might be an easy fix that makes a surprising difference. Finally, let's look at a category of medication that is incredibly common for managing heart health as we age: statins, the cholesterol-lowering drugs. Statins are prescribed to reduce LDL cholesterol, often called bad cholesterol, in the blood. High LDL cholesterol is a major risk factor for heart disease, heart attacks, and strokes, as it contributes to the buildup of plaque in the arteries. Statins work by blocking an enzyme that your body needs to make cholesterol. This lowers your cholesterol levels, which is vital for keeping your arteries healthy and reducing your cardiovascular risk. You've probably heard of names like atorvastatin, simvastatin, rosuvastatin, or pravastatin. The link between statins and erectile dysfunction is a bit more complex and sometimes debated compared to the other medications we've discussed. Some studies have shown that statins can potentially lead to erectile difficulties in some men. The proposed mechanisms are varied and not fully understood, but some theories suggest that statins might lower testosterone levels, though studies on this are inconsistent, or affect the health and function of blood vessels in ways that could indirectly impact erectile function. However, it's also important to know that other studies have shown that because statins improve cardiovascular health and blood flow by reducing plaque buildup in the arteries, they can actually improve erectile function in men who have high cholesterol and existing vascular issues. Erectile dysfunction is often an early warning sign of underlying cardiovascular disease because the arteries in the penis are smaller and show damage from conditions like high cholesterol or high blood pressure sooner than larger arteries. So, for some men, taking a statin and improving their cholesterol and arterial health can lead to better erections over time. This is where the situation gets a bit nuanced. Is the erectile difficulty being caused by the statin itself, or is it a symptom of the underlying high cholesterol and cardiovascular disease that the statin is trying to treat? It can be hard to tell. What is clear is that statins are extremely important medications for many people over 60 to prevent serious, life-threatening cardiovascular events. Stopping a statin without your doctor's guidance would be very risky and could significantly increase your risk of heart attack or stroke. If you are taking a statin and have noticed issues with your erections, it is absolutely essential to discuss this with the doctor who prescribed your statin, which might be your primary care doctor or a cardiologist. Don't assume the statin is the cause, but don't rule it out either. Your doctor can evaluate your overall cardiovascular health, assess your risk factors, and consider whether the statin might be playing a role. They might consider if switching to a different type of statin is an option, as different statins can have slightly different side effect profiles. Or they might explore other ways to manage your cholesterol, perhaps through intensive lifestyle changes alongside medication, or considering non-statin cholesterol-lowering medications if appropriate, though statins are usually the first-line treatment due to their proven benefits. It's also possible that your doctor might recommend trying one of the ED medications we mentioned earlier, like sildenafil or tadalafil, to see if that helps manage the erectile issues, while you continue taking the statin, that is protecting your heart. The conversation should always be about balancing the very significant benefits of statin therapy for your heart health, with any potential side effects you are experiencing, including those related to sexual function. Your doctor can help you make an informed decision that prioritizes your long-term health and well-being. Don't hesitate to bring it up. It's a legitimate concern that warrants medical attention and discussion. Managing your cholesterol is vital, and finding a way to do that, while also addressing sexual health concerns, is a goal worth pursuing with your healthcare team. So, we've talked about 5 common types of medications. Certain blood pressure medications, like beta blockers, certain antidepressants like SSRIs, prostate medications like alpha blockers, and 5-alpha reductase inhibitors, older antihistamines, and statins for cholesterol. It's important to remember that these are just 5 potential culprits. Erectile difficulties can be caused by many factors, including underlying health conditions like diabetes, heart disease, obesity, nerve problems, hormonal imbalances, smoking, excessive alcohol use, stress, anxiety, and of course, age itself plays a role in overall bodily changes. Medications are just one piece of a complex puzzle. The most important takeaway from this discussion is not to jump to conclusions, or, worst of all, to stop taking any prescribed medication on your own. These medications are prescribed for important, often life-saving or symptom-alleviating purposes. Suddenly stopping them could have serious consequences for your health. Instead, the goal is to empower you with information so you can have an informed conversation with your doctor. If you are taking any of these types of medications and have noticed changes in your erectile function, bring it up at your next appointment. Be specific about when the difficulties started and what medications you are taking. Your doctor is the expert who can look at your full medical history, your list of medications, and your specific symptoms to help figure out if there's a connection. They can then explore options with you, whether it's adjusting a dose, switching to a different medication, or exploring other treatments for erectile dysfunction that are safe to take alongside your current medications. Remember, your health is a team effort between you and your healthcare providers. Open and honest communication is key to getting the best care. Don't feel embarrassed to talk about erectile difficulties. It's a medical issue like any other, and it's a common concern, especially as men get older. Addressing it can significantly improve your quality of life and your relationships. It's also a great reminder that taking care of your overall health, eating a balanced diet, getting regular exercise, managing stress, getting enough sleep, avoiding smoking, and limiting alcohol is beneficial for every aspect of your well-being, including your sexual health. Lifestyle changes can sometimes improve erectile function, regardless of medication side effects, and they can also help manage the underlying conditions for which you might be taking medication in the first place, potentially allowing for dose reductions or changes over time, always under medical supervision, of course. So, take this information, reflect on your own situation, and most importantly, schedule that chat with your doctor if you have concerns. You deserve to feel your best in all aspects of your life. Small steps, like having an open conversation about your medications and their potential effects, can make a big difference in finding solutions and improving your health and happiness. I hope this has been helpful and has given you some valuable information to think about and act on. If you found this video useful, please give it a thumbs up. It helps us know what kind of content is most valuable to you. And if you have any thoughts, experiences, or questions you'd like to share, please leave a comment below. Hearing from you helps build a supportive community here. Also, consider subscribing to the channel if you haven't already, and ring the notification bell so you don't miss out on future videos about health and well-being for living your best life at every age. Thank you for watching. And remember, knowledge is power when it comes to your health. Take care of yourself and keep the conversation going with your doctor. Live your best life at every age.